Hi, everybody. Today we're going to talk about the second portion of neurons. In this video, we're going to talk about neurotransmitters. Neurotransmitters are the chemical substance that's released into the synapse. A synapse is a fluid-filled gap between two neurons. We're going to call these neurons the transmitting neuron and the receiving neuron. The fluid-filled gap is where the neurotransmitter is released. Each neurotransmitter has a slightly different shape, and they are picked up by the most um, accurate or most like shaped receiving neuron. It's almost like putting a key into a lock. When you put a key into a lock, only certain keys fit into certain locks, and that's the same with the neurotransmitters. Now, when thinking of a neuron, remember that a neuron is electrical impulse, but the neurotransmitters, or what it's emitting out of the neuron, is a chemical. So understanding the difference between that electrical impulse we talked about in the first neuron video and this chemical substance of the neurotransmitters that it is emitting or releasing out into the synapse is a very important part of understanding the neuron. The action of the neurotransmitter is that it binds with these receptors in the receiving neuron, and it creates one of two responses. It creates either excitatory response, which it means it makes other neurons fire, or it creates what's called an inhibitory response, where it stops neurons from firing. Whatever is not used or the unused neurotransmitters that are found in the synapse will be pulled back into the transmitting neuron in a process called reuptake. If you notice in the picture of the normal communication, what's happening is it's a circular cycle. So the neurotransmitter is being released into the synapse, it's being picked up by the receiving neurons, and whatever is unused is being sucked back in to the transmitting neuron to be reused again in a process called reuptake. Now, there are multiple types of neurotransmitters, and we are only going to talk about the types that are related to psychology. So these are the neurotransmitters that are related to psychology. The first one we're going to talk about is acetylcholine. Acetylcholine looks at memory and memory function. Having a deficiency in acetylcholine tends to mean that you have symptoms of dementia or Alzheimer's. And the medications that work with Alzheimer's actually work to bind with the acetylcholine to make a flooding of acetylcholine within your brain. This will slow down symptoms, but as we know with Alzheimer's, there is no cure for it. But there is a way through medication that possibly that the disease can be slowed. Dopamine, norepinephrine, epinephrine, and serotonin are within a group of neurotransmitters. Dopamine, a lot of people know is like the pleasure neurotransmitter. But what we want to talk about with dopamine is the oversensitivity of it or the deficiency of it. With dopamine, the oversensitivity creates an issue called schizophrenia. Schizophrenia is a chronic mental health issue, and it affects more males than females. And it is our most chronic disorder that we have. Uh, an oversensitivity of dopamine means that the body is sensitive to the amount of dopamine that's being spread into the synapses. And then if there is a deficiency in dopamine, we see a disorder called Parkinson's. Parkinson's is a neurological and muscular disorder. And a celebrity who has kind of been an advocate for Parkinson's is Michael J. Fox. Um, Parkinson's, one of the issues that we're seeing with some of the medications that are being given with Parkinson's is that individuals who are taking them are having psychotic moments. This was found to be one of the things that they thought might have caused the suicide of Robin Williams, was that he was taking medication for his Parkinson's diagnosis and in turn was having psychotic episodes, which would look at the deficiency of the neurotransmitter dopamine in the brain, but then there was also an oversensitivity within the body, creating that psychosis or those schizophrenia related symptoms. Norepinephrine is the second neurotransmitter in this group we're going to talk about. Norepinephrine is our non-adrenaline. Basically, what norepinephrine looks at is how we metabolize carbohydrates and our metabolism and our wakefulness and alertness based on how much sugars and carbs that we take into our body. If you've ever eaten a big Thanksgiving dinner, you know after Thanksgiving, most people pass out, and that is because of the norepinephrine levels are basically telling you to stop eating. And in order to stop eating, they put you to sleep so that they can metabolize the sugars and the carbs in your body, and then they'll wake you up when that metabolism has occurred. Epinephrine is your adrenaline. Most of us do not see big surges of epinephrine in our body, but if you've done extreme exercising, extreme weightlifting, then you would see, or if there was any kind of like extreme lifting, like if you've ever heard of, a mom pulls a car off of a child who's been hit, that would be a surge of epinephrine within your body. And serotonin deals with impulsive behaviors. It deals with mood disorders. It deals with suicidal ideations. Serotonin is the neurotransmitter that really keeps us from having depressive symptoms. So if there is a lower level of serotonin, you will see depression, you might see hostility, anger, and the group of serotonin medications, which are called SSRIs, the selective serotonin reuptake inhibitors. What they basically do is they block the reuptake of serotonin in your brain, which causes you to have a flooding of serotonin, which increases your mood and creates the ability for you to have a higher mood or a more stable happiness. The amino acids are another group of neurotransmitters. We're going to talk about two of them, glutamate and GABA. Glutamate is our primary excitatory neurotransmitter in the brain, which means it's the primary neurotransmitter that makes others fire. GABA is the primary inhibitory neurotransmitter in the brain, which is the primary neurotransmitter that makes other neurons stop firing. Now, GABA also works with anxiety in the brain. And what we have determined is that anti-anxieties such as clonopins, Ativans, Valiums, the benzodiazepines, and alcohol do work with the GABA receptors. And what they do is they create a lessening of anxiety. The problem is that also with the stopping of neurons firing, there's an increased risk of seizures. So if anybody has ever taken Klonopin or Ativan or any of the benzos, what they will read on the bottles is that if you stop use, that there is a higher risk of seizures, a higher risk of death due to stopping it without decreasing your dosage, your regular dosage. So two of the main drugs that can kill you from withdrawal are alcohol and benzodiazepines. Okay. And endorphins are the last ones we're going to talk about. Endorphins are our natural opiates in our body. They create a numbing feeling when severe pain has occurred, or there's a broken bone, or some kind of issue within our body that's causing us discomfort. And they are released into our body when that occurs to kind of numb the pain or to provide a numbing feeling. They bind with the drugs that are given for pain, so anything like codeine, anything like Percocets, Darvocets, oxycodone, morphine, and then of course the drug heroin. They all bind with the endorphins and create an increase in the numbing and the pain response. So here you're going to see the effects of drug on the brain. This is a normal example, the normal communication. And then down below, you see the communication when cocaine is present. When looking at this, you see that the transmitting neuron is flooding the system of the synapse with a whole bunch of neurotransmitters. The receiving neuron is picking up a whole bunch more neurotransmitters, and there is actually a block that is occurring that is creating it to not do that natural circular pattern and to block the reuptake so that the system gets flooded with whatever drug or medication is present. And then this just gives you a YouTube video on the effects of drug addiction and that kind of circular pattern versus the reuptake being blocked. And then this is just a optional video on the brain and the different parts of the brain. The next lecture will be on the CNS, the PNS, and the endocrine system, and we will see you then.